Do you frequently feel very tired, even after a good night's sleep? Or maybe your belly feels full all the time, even when you haven't eaten much. What if I told you that these quiet signs could point to something serious happening inside your liver or spleen? One rare but dangerous condition that can cause this is called hepatosplenic T-cell lymphoma, or HSTL. It's a type of cancer that affects a specific kind of white blood cell, T cells, and mainly grows in the liver and spleen, not in the lymph nodes like most lymphomas. Imagine your body's defense system turning against you in stealth mode. That's HSTL, sneaky, rare, and serious. It mostly affects young men, and often shows up after years of using drugs for autoimmune diseases like Crohn's or psoriasis. Let's break it down in a way that makes sense for real people, not just doctors. So what causes HSTL? Think of your immune system like a team of bodyguards. Sometimes medicines used to calm an overactive immune system, like those for Crohn's disease or rheumatoid arthritis, can accidentally weaken certain bodyguards called T cells in a way that makes them go rogue. Drugs like azathioprine or anti-TNF agents, infliximab, adalimumab are helpful for many, but in rare cases, they may quietly increase the risk of HSTL over time. It's like turning down the volume on your home alarm so much that a thief sneaks in without notice. Most patients diagnosed with HSTL have been on these drugs for years. It's not common, but when it happens, it's serious. Scientists also think that past infections like Epstein-Barr virus, EBV, might play a role, but most HSTL cases are EBV negative. So the bottom line, long-term immune-suppressing drugs, rare but real risk for this aggressive cancer. Now let's talk about how HSTL shows up in real life. Have you ever felt your belly seems bloated, but it's not gas? Or maybe your doctor said your spleen or liver is enlarged during a checkup. People with HSTL often don't feel sick at first, but slowly symptoms sneak in: constant tiredness, like your phone at 1% battery, night, sweats waking up soaked, unexplained fevers, and losing weight without trying. Your belly might ache on the left side spleen or right side liver. Also, blood tests often show low platelets, you bruise easily, or low red blood cells, you feel weak and pale. Imagine walking into work every day feeling like you've run a marathon overnight, no energy, no clear reason. That's HSTL talking. And here's the trick: no swollen lymph nodes, which is unusual for lymphoma. So doctors might miss it early. That's why listening to your body matters. How do doctors find HSTL? If your blood looks strange and your spleen is big, they'll order several tests. First, blood work checks your cell counts. Then imaging like ultrasound or CT scans show if your liver or spleen are enlarged. But to confirm HSTL, they need a biopsy, taking a small sample of tissue, often from the bone marrow, or sometimes the spleen. Think of it like taking a tiny fingerprint of the problem. Under a microscope, doctors look for abnormal T cells with specific markers like TCR gamma delta. Flow cytometry and genetic tests help confirm it. Once diagnosed, treatment is tough. Chemotherapy like CHOP or more intense regimens is often used, but HSTL doesn't respond well. The best shot: a stem cell transplant, replacing your body's broken immune system with healthy cells from a donor. It's like rebooting your computer when the software is corrupted. But even that doesn't always work, so early diagnosis is key. Can you prevent HSTL? Not directly, but you can be smart. If you're on long-term immune-suppressing drugs, like azathioprine or biologics, work closely with your doctor. Ask, should I be monitored for rare side effects? Regular blood tests and checkups can catch early signs. Don't stop medication without talking to your doctor, but do stay informed. If you notice ongoing fatigue, unexplained fevers, or a bloated belly, speak up. Think of it like car maintenance. Ignoring odd sounds might lead to a breakdown. Also, avoid unnecessary immune suppression. Ask your doctor, are there safer alternatives for my condition? Being proactive is your best defense against something as stealthy as HSDL. Scientists are finally paying more attention to this rare disease. Recent studies are exploring targeted treatments, drugs that go after specific flaws in the cancer cells. For example, drugs like brentuximab vedotin, which targets CD30, though not all HSDL cells have it, are being tested. New immunotherapies and JAK-STAT pathway inhibitors are in early trials. Researchers are also using genetic sequencing to understand what turns T cells cancerous. Imagine giving the cancer a GPS tracker so you can attack it precisely. This is the future. Also, global registries now collect HSDL cases to find patterns and better treatments. While progress is slow, because it's so rare, every small step helps. For patients, joining clinical trials might offer hope and contribute to bigger breakthroughs.